Today we're going to talk about strength training. The first thing we need to know is that muscles follow a simple rule: use it or lose it. As a result, a main concern in aging is muscle mass loss. After many years of not using muscles, many people find that they're unable now to perform activities of daily living, such as housework, yard work, or even get out of bed. However, strength training can not only reduce the loss of muscle mass, but can even reverse it. Therefore, getting the recommended amount of strength training can lead to healthier aging and give you greater independence as an older adult. So, what are the recommendations? The physical activity recommendations for strength training state that you should get 2 days of strength training per week. Any modality is fine as long as there's some resistance. And so you could do body weight, you could do resistant bands, weights, whatever is fine, as long as you're using those muscles to lift some sort of resistance. The amount of volume you want is between 2 to 3 sets of 8 to 12 reps, and you want to make sure you hit each muscle group. Let's break these recommendations down a little bit more. So first, let's look at what it means to be a set and a rep. And so when we say 8 to 12 reps, what we're meaning is that you'll do that exercise 8 to 12 times without much stopping. So you're not taking a rest. But then once you're done with those 8 to 12 reps, you'll take a rest and you've completed one set. And then you'll repeat that exercise again 8 to 12 times, and then that will be set number 2. So we can think of the reps as the individual exercises, and then the sets as kind of the bundle of those reps together. The guidelines don't specify how much rest you should take between sets. I would recommend starting between 2 to 3 minutes of rest, and then as you become more fit, you can cut that down and try reducing it closer to a minute or even 30 seconds. Help save yourself a little bit of time. But when you're just starting, give yourself plenty of time. You're just getting started. Be friendly to yourself. So what does it mean to hit all the muscle groups? So what we want to do is make sure that we're shading in the diagram. So we're trying to hit each muscle group twice a week. Another way to look at this is you can look at this checklist, which will be in the additional resources. And we're trying to put two checks in each row during a week. And so those muscle groups that we're trying to hit are our front of our arms, the back of our arms, chest, back, shoulders, core, the front of our upper legs, the back of our upper legs, and our calves. A couple safety notes about a strength routine is that we expect you to be a little sore or stiff after those first sessions. That's normal. However, we don't want you to feel pain in your joints, or you don't want to go too overboard that you're really sore and making yourself miserable. I know everyone's heard of the phrase no pain, no gain, but that simply isn't true. Science suggests there's a lot of gains even without pain. So if you do have some soreness in a joint or an area that bothers you during a certain exercise, I'd recommend avoiding that exercise or finding a less challenging variation. If that pain persists, you should consult with your doctor. You should also consult with your doctor if you experience dizziness, chest pain, or pressure in your chest, or nausea. So the positive note is that these exercises will get easier over time. What this means is that you're going to be gaining strength and fitness as you go. And so what feels challenging right away in those first couple of weeks will start to get easier as you go. So don't be discouraged right away if things are challenging or you have to start with a easier variation of exercise. You're building up, you'll get there. Strength comes over time. It will happen. If you want to keep making strength gains, you do need to add either some reps or extra sets or some sort of resistance, or you need to find some more challenging exercises. So if you're finding that by the time you've done the same routine for a couple weeks and things are going really easy, if you want to keep making strength gains, you need to add a little bit more to it. But like I said, this means you shouldn't be too frustrated at first, because I promise you that you will improve. As long as you stick out those tough parts early on, you will see gains, and you just got to keep investing in yourself. And most importantly, with any strength routine, you got to listen to your body. Some days you'll feel better than others, and that's totally fine. So on the days you feel good, you should be working pretty hard. On the days you don't feel good, keep it on the low end. Don't push yourself as hard. So strength training can be simple. It doesn't require any equipment. It can be done at home or anywhere, really. And it promotes healthy aging. If you're looking for a program to hit this recommendation, go below this and you'll see the program that I made for this, and you'll also see additional resources. So let's go hit that strength recommendation.